about sabiston, chapter number 72, urological infection. Okay, so more than 50% women and 12% men develop UTI during their lifetime. Okay, so females are more commonly affected. Okay, so urinary infection considered uncomplicated when it occurs when immunocompetent host without any underlying anatomical or physiological abnormalities of urinary tract in female. So in female should be immunocompetent and there should be no anatomical and physiological abnormality. So it will be uncomplicated. Okay, mind it, it's regarding female. Then UTI in diagnose, whenever you diagnose UTI in male, it is always complicated. Okay, remember that. Okay, so there is 10 to the power 5 colony forming unit should be there to call it as UTI. In catheterized specimen, it is 10 to the power 3. So C is 3. Okay. So uncomplicated UTI occur in pregnant female. This is also a third category. So male, female, and pregnant female. Okay. So there is a risk factor for UTI. So in population, when frequent sexual intercourse, initial UTI at young age, and maternal history of UTI, and number of pregnancy and deliveries, these are the risk factor of UTI. Okay, so there is on examination, whenever you palpate the vertebral tenderness, assessing the ascending infection. Okay, so most common cause of infection is E. coli, around 80%. Okay, now come to the Staphylococcus saprophyticus. Remember this name also important. Next most common. Then Klebsiella pneumoniae and Proteus mirabilis. So Staphylococcus saprophyticus. Okay, saprophyticus. Okay. Now come to the complicated urinary tract infection. So complicated occurs in male. Okay, mainly with in diabetes, immunosuppression, upper tract infection, resistant organism, okay, associated with anatomical abnormalities, prior surgery, calculus disease, spinal cord injury, or recent or current indwelling Foley's catheter. Okay, so this can causes the complicated UTI. Okay. So urinary tract infection in men. So younger men, generally less than 50 years, and older men more than 50 years. So 50 year is cut off. Less than 50 young, more than 50 is old. Okay, so both have different cause of UTI and symptom. So young men mainly UTI because of STI, sexually transmitted infection, and older men mainly because of lower tract urinary symptom. Okay. Now come to the pyelonephritis. Okay, so pyelonephritis is may be treated as an outpatient. Remember, the pyelonephritis is treated as outpatient with the oral antibiotic for 1 to 2 weeks. Okay, and you can go for urine culture. Okay, culture is necessary. Then emphysematous pyelonephritis, this topic is important. So this is advanced form of pyelonephritis. Okay, and consider urological emergency. Okay, mainly seen in diabetic patient. Okay, and there is a gas forming organism, mainly E. coli. Okay, so common bacterial pathogen E. coli, Proteus mirabilis, and Klebsiella pneumoniae. So these are the gas forming organism, but most commonly E. coli. Okay, so you can go for percutaneous drainage. Okay, this is the CT picture of emphysematous pyelonephritis. Okay, so extensive destruction of right kidney with intraparenchymal gas. Okay. Next is, and if you can go for percutaneous drainage, or you can also go for rapid nephrectomy. Okay. So broad spectrum antibiotics also you have to start. Okay. Now come to the granulomatous pyelonephritis. So remember, it's granulomatous. So it is chronic form of disease. Okay, because of renal obstruction, recurrent infection, or calculus. Okay, calculus, remember that. So there are three forms: focal, segmental, and diffuse. Okay, so in histology this is very important MCQ. So you will get foamy lipid laden macrophage. Okay, and there is a extensive inflammation, fibrosis, and loss of renal function. Okay, so you on imaging you will see the dilatation of collecting system. Okay, on focal and segmental disease there may be treated with antibiotics, but diffuse disease required nephrectomy. Okay, okay. So risk of iatrogenic adjacent organ injury high because of this fibrosis. Okay, and fibrosis of the renal vessel. Because of fibrosis you cannot ligate the renal vessel or separate the renal vessel individually. Okay, okay. So now come to the male genital organ infection. So prostatitis. So mostly infection of the prostate are secondary to gram negative bacteria. Remember, gram negative. Okay, okay. So on you can avoid the digital rectal examination when you suspect the prostatitis. Very important question. They will give you in option, you will do DRE. No, you should not do DRE in prostatitis. Okay, then pressure exerted on the, why you are not going to do DRE? Because pressure exerted on the infected prostate may lead to hematogenous spread of the bacteria. Very good assertion and region MCQ. Okay, then prostatic abscess. Okay, so typically do not respond to antibiotic therapy. Okay, so you required a transurethral unroofing to allow adequate drainage. Important MCQ. Okay, now come to the epididymoorchitis. Okay, so younger male less than 35 years, chlamydia trachomatis, older men because of E. coli. Okay, chlamydia because of STI. Okay, and older because of UTI. Okay, okay. Now comes to the Fournier gangrene. Very important topic, given multiple places, and almost all exam you will get one question from Fournier's gangrene. So it's a necrotizing infection of male genital and perineal skin and subcutaneous tissue. Okay, and this, the picture is very important, Fournier gangrene. Okay, okay. So on the patient present with the crepitus and foul smelling discharge. Okay, and it is because of polymicrobial infection. Okay, so because of peripheral vascular disease, risk factors are peripheral vascular disease, diabetes, malnutrition, alcohol, and immunocompromised state. Okay, so treatment is aggressive debridement of necrotic tissue. So early aggressive debridement. Okay, and broad spectrum IV antibiotic and intensive monitoring. Okay, so it is very rare to involve testicle or deep tissue of the penis, deep to tunica vaginalis and buccal asphyxia. Okay, okay. So uncommon for urethra to involve. Okay, so very uncommon to test involvement of urethra, testis, and penis. Okay, so suprapubic tube diversion is generally not necessary. Okay, and a urethral catheter, you can go for urethral catheter generally. Okay, okay. Now fungal infection, most common fungal infection is candida. Remember that. Okay, now TB. So TB is third most common extrapulmonary site. Genitourinary tract is third most common extrapulmonary site. Okay, mainly spread through hematogenous from the lungs or affected organ. Okay, so not all patients have positive purified protein derivative test result. Okay, so diagnosis is confirmed by AFB, acid fast bacilli smear of urine and mycobacterial culture with sterile pyuria. Chest radiograph and imaging of genitourinary system is also needed. Okay, so ureteric stricture is common sequelae. Okay, okay. So antibiotic therapy consists of 2 months of 4 drug regimen and 7 month treatment for 2 drug, isoniazid and rifampicin. So initially 2 months for 4 drug, next 7 month is 2 drug, total 9 months. Okay, okay. Last few points. So significant anatomic infection or fundamental change, functional change and loss may require surgical excision. So in which case you need surgery in a TB patient. So significant anatomical infection and functional change or loss. Okay, okay. Then parasitic infection. So most common parasite is schistosomiasis, and most common affected in genitourinary is bladder. Okay, and which drug is praziquintal. Okay, schistosomiasis you give praziquintal. Okay, so this much you should know in genitourinary infection. Thank you.